Once you've given birth to your baby, we'll be helping you to use a combination of hand expressing and using a breast pump. And we will help you right from after you give birth. So within 2 hours of birth is what we're aiming for, to really start firing up those receptor cells in your breasts. If you've delivered prematurely, then your breasts haven't gone through that final stage of development. And we really want to give your breast every opportunity to really kickstart your lactation for setting up breastfeeding. So we will help you to hand express, which we've discussed in the last video, and then we will bring you a breast pump, and we recommend that you use it on initiate phase. The initiate phase is a specific setting that this company have come up with, and it mimics a baby during the colostrum phase. It does a combination of little sucks and a combination of big sucks, and it pauses twice. And what they've done is they've looked at the sucking patterns of hundreds and hundreds of babies while they're still getting the colostrum, and they've mimicked it using the pump. It will run for 15 minutes and then it will turn itself off. Once your milk starts to come in, you would use a different setting, but we'll be discussing that in the next video. So it's really important that you hand express, because that's how you collect the colostrum. The breast pump, you will notice, doesn't collect the colostrum. You'll be using it and thinking, but nothing is coming out. That's normal. So it comes in very thick, gloopy quantities, very, very tiny quantities. And so if you start by doing your massage and your hand expressing, collect the colostrum. That's the best way to collect the colostrum to give to your baby. But the breast pump is stimulating your breasts to produce the long-term volume, and also to bring your milk in nice and quickly. So for some women, the milk can be delayed up to a week, but for most women it comes in between days 2 and day 5. And you'll start to see a change in consistency. The milk will start to become yellow and creamy, and then it will get lighter, and you'll see it gets looser, and it will start to drip into the pot as you're expressing. That's your milk coming in. You'll also feel some breast heaviness. Again, completely normal, but the breast pump should help you drain the breast properly. And that's a normal physiology of breastfeeding. But you'll need to keep hand expressing until your milk comes in and to collect your colostrum. It's really important that you express at least 8 times a day. We're aiming for 8 to 10 times, and that's how often a baby would breastfeed. You've got these expressing logs, which will really help to guide you. But as an example of what might work for you, you can see it's got 10 sessions in there, and we're aiming to get to at least 8. As an example of what might work for you, I like to start from bedtime. So if you do one before you go to bed, it's really important to do one overnight. We know that your prolactin, which is your milk-making hormone, is highest at night time, between the hours of 1 and 5 o'clock. So it's crucial that you express in that time. However, I also recognise how important it is that a lactating woman gets sleep. So if you go from bedtime, say 10 o'clock, then give yourself 6 hours to sleep, which will still take you to between 2 and 4 o'clock in the morning, so that you are getting a block of sleep, but also expressing in that very important window. Then you've done 2. Do 1 as soon as you wake up, and you've done 3. Then do another 1 after breakfast, and you've done 4, and your day has barely begun. And you know that no matter what the day brings, you've managed to get 4 expressings in. If you then aim to do them around your meal times, it's quite a good reminder of to do them. We recommend you don't have a longer than a 4-hour gap between expressings. One, because we want to really stimulate your milk supply, but also if you leave them too full, that can lead to engorgement and mastitis, and we don't want that either. So keep your breasts emptied nice and frequently. So if you do another one then before lunch and another one after lunch, you've done 6 again before tea and after tea. That gives you the afternoon off. Have an afternoon nap, spend time with your children, do the things that you need to do, but make sure that you've had you've got in at least 8. And then you can do another one in the evening while you're watching telly, if you would like to, or you can do another one before bed. But you've done 8 or 9 in your day, and that schedule might or might not work for you, but take some time to really find a schedule that will work for you. So using the breast pump, here it is. We have this one on NICU, and on maternity they have a slightly different make. It has got the buttons on the front, and it's also got a button on the top which you press to open up the top, and that's how you connect the breast pump kits to the breast pump itself. Okay, so it's got a button here. So the buttons on the front, you've got an on and off button, and it will start the pump. If you press this button, which is the drop, it's got droplets on it, then it will start the pump on the initiate phase if you press it within 10 seconds. And it will come up with a circle. I don't know if you can see that, but it's got a circle on the little display here. It has a dial in the middle. That dial will increase the vacuum or decrease the vacuum so it's comfortable for you. Please make sure that it is comfortable. Breast pumping should not hurt. Okay, so if you set it up by pressing this button within 10 seconds, it will say initiate running, and it will run for 15 minutes and then turn itself off. It's a nice, easy setting to use. To put the kit together, it comes in a little plastic bag, so it's all sterile. You'll get 2 of them, 1 for each breast, and you can set both up at the same time, and we really recommend you double pump. You do 2 at the same time. So all the instructions are written on the side of each of the pumps, but you have a connector bit and you have a funnel bit which attaches onto the connector. These funnels come in different sizes, so make sure that this is a comfortable fit for you. If you're finding that it's pulling or dragging or you're seeing any blanching, it probably is that you'll need a different size funnel. So make sure you speak to your midwife, myself, or your neonatal nurse. You then have this little one-way valve with a little white flappy bit on it. That's important. It goes at the bottom there, and then you screw your bottle. These bottles are disposable. If your milk starts to come in and you start to get milk in it, of course, give it to your nurse, and I'll show you how to transport that in a minute with a lid on it. But if you don't get any milk, if you're still in the colostrum phase, just use a different one each time you express, and it screws on the bottom like that. You then have a wire which goes in the back, and that is what connects your breast pump kit to the breast pump itself. This wire and the little suction cup on the end of it, they don't get washed. You wipe those down with a clean wipe, and then you just store those nice and cleanly with your kit. The bottle, as we know, is disposable, so either you give it full of milk to your nurse and she will use that milk that's inside it and then dispose of the pot, or you dispose of the pot if it's empty each time. These 3 bits here, you wash with warm soapy water. Normal washing up liquid is absolutely fine, and then you rinse them out under the tap, and then you dry them with paper towel or a very clean tea towel. Preferably paper towel, because then you know it's really fresh and clean each time. You dry them really thoroughly, and you get your fingers in to get into the nooks and crevices. Make sure that everything is super duper clean, and then you store it in a sealed container. So we recommend you bring in a lunchbox of some kind which has got a sealed lid to store your kits in hospital. You will have a kit at the hospital for you to use when you're spending time with your baby, and when you go home, we'll send you home with a breast pump and 2 more kits to use at home. So make sure that before you're discharged, you have the pumps from NICU and all the kits so that you're completely set up and ready to go. When you transport your milk and you store it, once you've expressed it, put it in the fridge. But it's important that, like with the colostrum, you've labelled it. So you'll have your pot of milk or while you're still in the colostrum phase, you'll have your syringe of milk, and you will need to put a label on it with your name and the time and the date that you've expressed it. You could put your baby's name on it, but we need to know whose milk it is, and then you put it onto your bottle. When you're bringing your milk in from home, if you're discharged home, you need to have put it in the fridge, and then to take it from the fridge to bring it into the unit, we will give you a cool bag that looks like this, very kindly donated by our neonatal charity Little Roo. And if you just pop some ice packs in the bottom of it, you would then put your milk inside it to transport it. While we have all the COVID regulations, what we're asking you to do is to put your labelled milk inside a plastic bag. So you put them all inside the plastic bag, and you put the plastic bag inside the cool bag, and you bring them in like that. You hand the whole lot to your nurse, and then she will safely transfer your milk into the fridge on the neonatal unit, and she'll give you back your cool bag ready for going again. You'll find lots and lots of bottles and syringes and everything you need in the milk kitchen on NICU, and we'll be able to show you that when you arrive. The milk can be kept in the fridge for up to 2 days. If you think that you're unable to get the milk to your baby within 2 days, please put it in the freezer. It can be kept in the freezer for up to 3 months, but once we've defrosted it, it has to be used within 24 hours. So if we can use your fresh milk, we'd rather do that. So make sure that you're able to get the milk to us nice and frequently so that we can give your milk to your baby. In the next session, I'll be talking to you about the maintain setting.